Welcome back, everybody. We're part of the Really Cool Humans Network. I'm Dr. Casey Oliver.
And I'm Dr. John Hatch.
And today we're going to talk to you about a little piece of equipment that we use in our office called somatosensory evoked potential. And this is an awesome unit that we got. This is the Sierra Ascent from this company called Cadwell. Some of their older models were the Wedge, the Wave. We decided to go with the Ascent because it kind of fits our needs. This is something that Dr. Frederick Carrick and a lot of the other chiropractic neurologists use a lot in their office, and we're going to explain why today. So basically, this thing does a lot of different diagnostic tests. Like this, we can run EEGs if we wanted to on here. EEGs are electroencephalograms, and those are really beneficial when you're trying to diagnose epileptiform type disorders and diseases. We can also do EMGs, NCVs within our scope of practice. In here, especially here in the state of Utah, we can't penetrate the skin, so we're not using this piece of equipment to do NCVs and EMGs. We refer out for that if we need patients that for example, someone with carpal tunnel. How many people do you see that have carpal tunnel?
Quite a bit.
Quite a bit. So if we're going to test the median nerve, for example, you place the electrodes or the needle EMGs, and you send a signal down, and this piece of equipment is really beneficial for measuring stuff like that. What we use this for, you can see this piece of equipment right here. So what we have every patient do is we're going to have them hold on to the ground wire here, and I'm going to just show an example of a couple different applications that we use for this. If Dr. Hatch, if you want to hold on to that.
So you might ask yourself, well, what's the significance for me as an individual? Why would I need this therapy to be used? One of the important things to understand about your brain is your brain is constantly receiving input from your peripheral nervous system, the input from these sensory organs. Well, one of the biggest maps on your brain is this parietal lobe here. You have a somatosensory map, and it maps where all your body parts are, and you have to know where those are. And when we get injured and when we get damaged, some of this gets skewed. And there's actual local areas of dermal tonal patterns, which is an actual nerve root pattern, and then you have a cutaneous sensory map of the same area that are hitting different nerves and different excitations of the brain. So what we use this for is an electrical stim. Now you might say, what's the difference between ultrasound? And what's the difference between a TENS unit? Can I just use that? There's a specific sinusoidal wave that's used that this SSEP is specific for, that can activate, that they say there is nothing that activates that parietal lobe more precise than that. So if I need therapy directly in from, I'm getting a lack of input because I've had an entrapped carpal tunnel syndrome. So now the brain's not getting the input from the hand because the nerve is pinched. The sensory nerve will always be affected faster and first before the motor system is affected. So if we can use an electrical stem on the median nerve, you're going to get a better feedback up into that cortex and create a little motor response. So we're going to show you how it works.
Yep. So like Dr. Hatch said, this is all about, as human beings, we are receptor driven, and we've talked about this before. And so this is one of the, within our scope of practice, we don't prescribe medications and we don't do surgery, so we've got to use the systems of the body. This is an awesome way to access certain parts, especially when you can get as specific as we can get. Like Dr. Hatch mentioned, looking at the image there, we can get to very specific peripheral nerves and innervate those nerves and access certain parts of the brain that we need to get to. So for example, we're going to turn this on here, and we're going to show you how this application actually works. So what we do is positive goes towards the brain, negative away from the brain. So when we're working with the median nerve, for example, we're going to come down here and access that nerve. And with Dr. Hatch, what I'm going to ask you is, when do you feel it? Just tell me when you feel the impulse.
Right there.
Okay. So we hold this for a count of 15 seconds, and we're going to repeat this 3 times. I'm not going to hold it for the actual amount of time there. But this is, for example, how we're going to treat median nerve. So in what cases would you do a right median nerve stim? Like when do you see this in patients when you're going to do this?
So often it would do it for patients that are dealing with a carpal tunnel-like syndrome. It could also be an entrapment, any type of peripheral entrapment. There's actually 3 areas that the median nerve can be trapped. And so we use the most distal to get innervation. The important thing is, too, is you can, when a patient has had a peripheral nerve injury, if you injure that, all peripheral nerve injuries can create central nervous problems. So by retraining that nerve pathway, you're going to get a better output to the function inside your brainstem and the cortex. Now, you'll see if we push the nerve impulse really hard, I can create a contraction. When we see patients that have lost feeling in their fingers or lost feeling in the palm of their hand due to some type of bad impulse, it's important that we do it just to a sensory change. Once you've had the sensory change, it's incredible that patients will come in and you'll see the number going up, and they might not even perceive the feeling until 13, 14, 23. And then after usage of time, 2-3 weeks of this electrical stim, they'll see that they can start to sense it at 5 and 6. And so that sensory map is becoming more sensitive as it is intended to. There's certain areas that will be more contractile versus others. But we use it just until you sense it. It's not always necessary that it creates a contraction unless we need that activation, but commonly we don't.
And like Dr. Hatch said, once you get this up, if the milliamperage is high enough, you're actually going to get muscle contractions. So you can see my hand moving here. I'm not doing that on purpose. This is the charge that's being put into the hand. And sometimes we might have to put it up this high. But it's for perception. So let's talk about a different part of the body that we use this very commonly on. So one that we commonly use daily with a lot of patients that we work with is the trigeminal nerve stimulation. So we use up here on the forehead is the branch V1 of the trigeminal nerve. We come down here, which is basically the maxillary portion of the V2 of the trigeminal nerve. Down here is V3. Commonly, we will use V1 and V2, and then we'll go in on the tongue to do hypoglossal stimulation. And so what that basically looks like, if I were trying to, for example, work a certain side or a certain hemisphere of the brain, you can obviously, it's right or left. I'm going to come up here on Dr. Hatch's forehead, and you tell me when you feel it. And again, just like the median nerve, we're going to hold that for 15 seconds, and you repeat that 3 times. So we can work V1, V2, V3, or hypoglossal also on the tongue.
And the great thing about it is you can get precise. You can get precise headaches. You're going to ask yourself about headaches. You know, I get the same headache on this left side. Okay, so there's a chance that we have one side more activated than the other. And through our neurological tests, we'll know exactly which side to treat. But you can have that little stimulus on the same side, on the opposite side. It just depends on what your brain individually needs.
I'm Dr. Casey Oliver.
I'm Dr. John Hatch. Thank you for tuning in with us today and us helping you understand a little bit more about what we do here and what the importance of an SSEP unit is. Tune in us next time. We look forward to that. If you have any questions or any comments, please contact us.
Our website's theneuroclinic.org. Again, that's theneuroclinic.org. Or you can give us a call anytime. Area code 801-766-6580. We'll see you next time.
Thank you.